Good morning.
Hi, Lisa.
Thank you for joining me today for my talk, which is entitled Why You Should Donate Blood. The reason why I picked this talk is that I'm a nursing student, and as part of my nursing curriculum, I have just realized a lot about there's a need for awareness and just greater knowledge on this topic. So, I've presented here a few reasons why people, have decided why they don't want to give blood or why I think they don't want to give blood. I do think that a lot of people do have a fear, as well as a lack of knowledge about the process. And they may also have not really a good understanding about who can and who cannot give blood. They also might view it as sort of a hassle. They might think, well, I don't really have time, I have so many other commitments, I have to take time off work, I'm really afraid of needles, I don't really want to give a whole health history. And so some of these issues I'm going to present in my talk and try to allay these fears and convince you that these these fears are something that should be overcome and it is a worthwhile cause. So the general requirements for giving blood, usually you have to be 18 years old. You have to weigh at least 110 pounds, and that's just so you're not going to get lightheaded or that you're not going to lose too much of your total blood volume. You have to be generally in good health, and there's a special type of blood donation that does require you to actually weigh a little bit more and be a little bit taller, and I'll go into that, but just for general whole blood donation, it's 110 and 18 years old. And then I think most of y'all do know that anyone who's HIV positive or has risk factors or symptoms, that's pretty much a no for being able to give blood. But a lot of you may not know about other conditions, can I or can I not give. So if you've had any sort of clotting disorder or blood cancer, like leukemia or lymphoma, that would be contraindicated. If you have sickle cell disease or active tuberculosis, then you cannot give. Also, any woman who is pregnant cannot give until 6 weeks after she's delivered. If you have any active fever or a illness, such as a rectal cough, an infection such as sinus infection, or if you're taking growth hormone, then you cannot give. So, a lot of you, if you've been on antibiotics before, you might wonder, well, can I really give blood? I'm on antibiotics. And the short answer is if you're on some sort of pill or tablet, that you could actually give if your course is complete, even if you're finishing your last dose the day of donation. If you're hospitalized and you have to be on IV antibiotics, then you have to wait 10 days post-treatment to give. Most immunizations do have a little bit of wait time, but the good news is that most people have had their immunizations as a child and they don't have to really worry about that after age 18. But a lot of healthcare workers are taking the Hep B immunization shot and the series of 3, and you have to wait 21 days after that last third shot, as well as there's wait time for German measles, mumps, polio, rubella, chickenpox. However, if you have your routine flu shot, then there's no wait, so you don't have to worry about that. The Gardasil, meningitis, or tetanus shot, you do not have to wait. For those that are diabetics, if you're on insulin, it's not a problem unless you're on insulin that is made from cows because of the possible risk for mad cow disease. So, you might be really surprised that, you can, with most medications, you can actually give blood, with a few exceptions. So I know a lot of people, especially as you get to middle age and older, that you may have like a laundry list of different medications and say, well, I can't give blood, I'm on too many meds. But in most cases, you actually can. And actually, you can call the Red Blood, the American Red Cross to find out if you're eligible or not, so that you wouldn't have to, go to a blood drive and then find out you're not eligible. Of course, if you have hepatitis D disease or disease or exposure, you have to wait a year before you can get blood. If you're on a couple of different drugs for, if you have an enlarged prostate, then you have to have a wait time. And what I found was a 6-month wait time, but obviously you're not going to stop your medication to give, so I would say that would be a contraindication, as well as some dermatological drugs do have to wait. others, such as Coumadin, heparin, or Lovenox, you have to wait a week. So a lot of these are sort of common sense things. If you're on aspirin, you can give whole blood, but you would have to wait 48 hours in order to give a platelet donation. And if you've had yourself a blood transfusion and you have no other risk factors, you still would have to wait a year just to make sure that you didn't have anything present itself in that time before you give. If you have a heart murmur, it's advised that you have no symptoms for 6 months in order to be able to give. And if you have certain heart conditions such as a heart attack, bypass surgery, or if you're on meds for a heart condition and you've had a significant change in your medications, then it's advised that you wait 6 months. Okay, so I wanted to go over different types of components of whole blood because you might get confused when you look at the American Red Cross website and see, well, what are, they're talking about platelets, they're talking about all these other things, and most of us know about whole blood. So whole blood does have all these different components. Red blood cells are red in appearance, and they have the important function of carrying oxygen to all the cells in the body. And there's a unique donation procedure that I just learned about with this talk called double red blood cells. And actually, what happens is that you have sort of an increased number of red blood cells that are obtained, and actually the liquid portion and the plasma platelets are actually returned to the donor, and it's done through this special process called apheresis that I'm going to talk about in just a minute. And then you have plasma, which is the liquid portion, and that is responsible for donating, transporting different nutrients in the body. And then you have platelets, and those are really great clotting factors. And so, apheresis is a technique that actually does the filtration of your blood. So if you did do a donation process that was other than whole blood, you would have it uses apheresis machine, and again, you have to call the American Red Cross to find out, when and where you can do this type of special donation. But it's very important because some people need these special components and not just whole blood. So I wanted to talk a little bit about different needs. Of course, whole blood has these different components. Red blood cells, who needs those? Especially people who have undergone surgery or trauma or a significant amount of blood loss really need to have red blood cells instead of whole blood. And a lot of times it's called packed red blood cells, and those that have an extreme amount of blood loss might be candidates for that double red cell donation. So those are particularly important for very critical cases. And platelets, a lot of cancer patients, they're undergoing chemotherapy, it's destroying their bone marrow, and they cannot make their own platelets. And so often they will need to be on this platelet, receive platelets from donors on an ongoing basis while they're undergoing that chemotherapy. Cardiac patients, and if you have an organ transplant, then you're going to be in need of platelets. And then plasma. Plasma is needed for anyone who has a clotting disorder. I listed a couple of different types of clotting disorders, but most of us are familiar with hemophilia being the most common. So I did found this slide here that shows a little bit about. It might be very interesting to know what your blood type is when you go to a doctor and they do blood work, because depending on your blood type, you might be a special candidate for a specific type of donation. So if you have no idea what your blood type is, then it's just recommended that you donate whole blood. However, red cells are for O plus and O negative. You know that that's your blood type. You're a great candidate for that. For plasma, you need to be either AB plus or AB minus. And for platelets, you need to be type A, plus or minus, or B, plus or minus. And I found it very interesting that the ideal, everyone knows like O negative is the ideal, donor or the universal donor of whole blood, but the fact that most people don't know is that for platelets, AB plus is the universal donor, and only 3% of the population is AB plus. So if you're, willing and able and a good candidate, and you are AB plus, you're really needed for the donation process. cycle that we need to look at. For whole blood, it's usually about every two months, and then platelets and plasma have a different time frame. And for double red cells, it's actually double. Instead of 56 days, it's 112. So even though the actual donation process takes longer to do a double red cell, it actually gives more benefit to the patient, and then you actually have less time that you have to commit because even if you want to be a designated donor, you only have to go half as often. So it has that benefit. So in conclusion, this last slide just gives you is sort of a call to action for why you should dispel some of your myths from the earlier slide of I don't have time, I don't want to do it, I'm scared of needles. Think about this. Every 2 seconds, someone in the United States needs blood. So count 1, 2. Someone needs blood. 1, 2. Another person needs blood. And, think about that in your idle time and think, well, do I really not have, 45 minutes of my time or, to go donate blood? Think about all the good that it can do. More than 41,000 units are needed daily. And this is a very interesting fact, is that 38% of the U.S. population is eligible to give blood, yet only 10% actually call to action and actually step up to the plate and do it. So I'm hoping that some of you out here would help us reach more of the goal of everyone who's eligible doing their service and being a good humanitarian. In my cancer, we have in my family, we have a lot of cancer, so this fact hit home that there are 1.6 million cancer patients that need blood each year, and during chemo, they're going to really need it. So, at some point, someone in your life is going to be needed for this. And it is, with some of these, even with some of these fears, it is really a safe, simple process. It doesn't cause you any harm, and it's going to save lives. And you never know when someone in your life is going to be touched and will need a donation. And a lot of you might say, well, I don't have time, I can't take off work, I'm in school, I'm so busy, I have this and that, and so many responsibilities. But on their Red Cross website, they have, you can type in your zip code of your home or your work, and they can show blood drives that are going to be in the area in the upcoming weeks. And there are several in this area in evening, weekend, and early morning. So I encourage y'all to look at the website and to carve out some time for that. And they also have what's called Rapid Pass online. So that streamlines the screening process. So you think, well, I don't want to spend 20 minutes with these questionnaires. You can go ahead, do your screening questionnaire online, print it out, and then when you go to your donation site, it's already done. So your time, hopefully, that you're at the donation center would be less. So I hope with all these facts that sort of clarifies a lot of myths and misconceptions and encourages everyone to look more into this as an option to help you, your family, and your fellow. Thank you so much. I appreciate your time. Thank you.